There's been a lot of excitement lately over some new antiviral medications for the treatment of COVID-19. These are treatments that are in tablet form and could be done at home and prescribed in the community, thus keeping people out of the hospital. So it's definitely worth talking about. Let's have a closer look. Just a warning that some of the data, especially with the Pfizer antiviral here, is based on a press release. This has not yet been peer-reviewed or published, so take all of this with a grain of salt. We have two different antivirals, one by Pfizer and one by Merck. They have two different mechanisms of action. Pfizer's antiviral is a protease inhibitor. Protease inhibitors are already used as antiretroviral drugs for HIV, and I will explain more about those in a few minutes. Merck's molnupiravir is a viral mutagenic. This medication interrupts the pairing mechanism of viral nucleotides. In this way, it inhibits viral protein production. It is a substrate of RNA-dependent RNA polymerase for those who are interested. With the protease inhibitors that we already use for HIV, these inhibitors block the enzyme protease. Thus, HIV cannot break down its proteins to make new viruses, and therefore it stops spreading. With HIV, the cells that are infected are the CD4 cells, and if you protect these cells, you also protect the person's immune system. These protease inhibitors are used in combination with other medications, and this may be the case for the new Pfizer protease inhibitor as well. Currently, the protease inhibitors that we already have approved by the FDA are listed here. The side effects of protease inhibitors that we are aware of right now include nausea, vomiting, diarrhea, dizziness, bit of a rash, increase or decrease in body fat, issues with blood sugar, also kidney stones. Antiretroviral medications can also cause something called immune reconstitution inflammatory syndrome. This can happen as the immune system strengthens. This can cause a flare-up of an infection that a person maybe did not know they had. Now, if the infection has already been cleared for the most part, it is thought that this reaction would not be as severe. So this is a side effect that we definitely want to watch out for with the Pfizer antiviral. As to efficacy, Pfizer's antiviral is looking to be about 89% effective. It was so effective that they actually stopped the clinical trial when they saw that they had enough data that they could no longer justify giving people the placebo over the antiviral. And Merck's molnupiravir is looking to be about 50% effective, still significant. Let's compare the two. So both medications are to be taken twice daily for 5 days. Pfizer says they have the ability to make 180,000 packs. With Merck, they say that they can produce 10 million courses by the end of the year. They have licensed the production of their medication to generic drug firms, and they are planning to increase production. Currently, Pfizer's paxlovid has plans to add clinical data to a rolling review to the US FDA for authorization, and Merck's molnupiravir, as you may know, has already been approved in the UK, and they've submitted for US authorization. That would be emergency use authorization. Side effects. With the Merck antiviral, there were no serious side effects in trial volunteers. However, there may be an issue for pregnant individuals due to the interference with RNA replication. This could be a concern for those who are pregnant or are planning to conceive. With the Pfizer, it was reported in the press release that 19% of people given the treatment suffered adverse events, compared with 21% who got the placebo. Pfizer declined to disclose what those adverse events were. We should know more about this in future. Advantages of these medications, like I said, they are able to be taken at home. They keep people out of the hospital, and your local general practitioner could prescribe them for you. So there are distinct advantages with these medications. We still don't know yet about drug interactions or long-term side effects. These medications will be approved with emergency use authorization. These medications will not be for everyone, but they should be useful for some people. They still don't seem to be as effective as the vaccines, which we know a lot more about, but they will be a very important tool in helping to combat this pandemic. So just to summarize, the pill-based therapeutics for COVID-19 that we have so far include molnupiravir from Merck, fluvoxamine, which is an antidepressant that is showing some very promising results against COVID-19, paxlovid paired with ritonavir antiviral, that would be from Pfizer, ivermectin, the jury is still out on that one, And vitamin D. It seems like vitamin D probably doesn't play as much into this as we might have thought. However, if you are in the Northern Hemisphere and you're not getting enough sunlight during this time of year, it's a good idea to consider supplementation. I hope you found this helpful. If you did, subscribe with notifications to be kept up to date with the latest in all things health and COVID-19. Take care and stay healthy. Bye-bye.